Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy. I am the owner of an award-winning physical therapy clinic here in Utah, Salt Lake City. In each episode, we dive into all things injury prevention, overall health, and bring you expert insight from leaders across various healthcare fields. Please note, while aiming to provide you with the best knowledge and advice, the opinions shared by those represent experts in the field and are not intended to replace medical advice. So let's revolutionize healthcare and wellness together. Today, I have with us Victoria, who is an insurance specialist on our team. And she has a unique perspective because, of course, like a lot of us, have been a patient, but she's also gone through and in different positions with our company. She's been an authorization specialist, and now she's a training specialist for our whole organization on insurance navigation. So today we're going to talk about all things improving with insurance companies. How do we advocate for our patients within Foundation? What kind of comes to mind, Victoria, as we talk about this topic? What's like right on top of your head?
Yeah, one of the first things that comes to my mind is we do what we call the patient financial agreement, and that essentially is a benefit check. And so we reach out to insurance for the patient to kind of find out what are their actual benefits for physical therapy. That way, they're not going to be stuck with a huge bill at the end that they're not aware of.
Hold on. So you're telling me you literally, as a service, you call their insurance for them, get their benefits, get an idea of what they're going to be paying, and then let them know prior to them seeing a therapist?
Absolutely. All of our front office is trained on this. They know how to speak with the insurance rep to find out not just their medical benefits, but what is their actual physical therapy benefit and how is insurance going to help them pay for that. It's all estimated, but we do our best and we get very close to those estimations.
How do we know how to estimate a physical therapy visit? There's so many complexities to it, but just let us know, how do you summarize that?
Yeah, absolutely. It's a lot of different parts. Part of it comes down to their accumulators. So what's their deductible? What's their out of pocket? Are they going to be paying a copay or a coinsurance?
A lot of those words are very foreign to a lot of people. Let's define the most important ones there. Tell us what a deductible is.
Yeah, a deductible is an amount that's set by the insurance, and what the patient pays goes towards that deductible before the insurance is going to pay out their benefits.
Okay, so essentially a deductible is you're going to pay the full amount of healthcare until that deductible is met.
Exactly.
And there's high deductible plans. What's typically a high deductible plan?
It ranges. It can be anything from $5,000 to $10,000.
So you're telling me if I have a $10,000 deductible, I'm going to be paying the full amount until that's met.
Correct.
Okay, and most of those plans have a low premium. So you're paying low amounts in the beginning, but if you have something come along, you're going to be paying the full amount.
Yep.
So is what you guys do at Foundation is you estimate it, you get as close as you can to what you think is going to be at each visit, and then you give them an approximate amount for each visit.
Exactly. So we write it all down on our patient financial agreement. We call it PFA for short. We write it all down and we present it to the patient. We show them, hey, this is your deductible. This is your out-of-pocket maximum. This is your copay or your coinsurance. And this is the estimated amount that we're going to collect from you at each visit. So they're aware and they know what their benefits are.
Yeah. Something that I think definitely needs to go away in physical therapy is a copay. Copay is what you are responsible for regardless of anything else. You just pay, say you have a $40 copay for physical therapy, and you just pay that every visit. The reason why it's an issue in physical therapy is because you're going to be seeing a physical therapist for 12, 14 visits, on average, and you're paying that copay every time. And we're listed as a specialist with most insurance companies, and other specialists you only see one time.
Right.
So in my mind, I'm like, why don't we just have a copay for one visit? Maybe that's something that we can change as we talk to insurance companies. And what's helpful from patients, like reach out to your insurance provider, because if you want things to change with insurance, they don't change things unless you recommend it.
And I think it's easier to reach out than we think. You just need to make a call, send in a survey, send an email of your thoughts and your feelings and how they can improve things for you and for your experience.
Do you really think that one patient can make a difference?
Oh, absolutely. Absolutely, because it's not just one patient. It's you and everybody else that has the same issue that you're having. And if we all reach out, it makes a difference. But if one person thinks that they're not, it's like voting, right? Every vote counts. And it's the same exactly with insurance. Every single patient counts, and every response, every survey is going to matter.
Yeah, and it is wild. I mean, a lot of people don't think that insurance companies will change things based on their phone call, but I've seen things change just from a patient calling in, right?
Yeah.
If you advocate for yourself, literally they're working for you. You're paying premiums.
Yeah.
If you're not getting the service that you want and you deserve, advocate for yourself. Have them escalate it to a supervisor, dig your heels in and let them know this is unacceptable. Is what they do is what insurance companies have told me. If people don't complain, nothing changes.
Yeah.
Right? And we all complain about it, but how many of us actually call our insurance and say, this is unacceptable, right?
Yep.
What are some things that you've seen in the clinic that you would recommend when it happens in the clinic that a patient calls their insurance and talks to them about? And I'm thinking, some of the things I'm thinking about is, maybe an MRI gets denied, or maybe they have to wait a week or two to get care. What are some things that you see?
Yeah, well, one of the biggest issues that I see is we have strong delays on authorizations. So we will submit a pre-authorization, which means we're going to submit notes to your insurance, and they're going to say whether or not they approve you having physical therapy visits.
This blows my mind that we go, as a physical therapist, we have a doctoral degree. Yeah, but I can't see a patient until I'm authorized.
Yeah.
Like, these insurance companies are making the decision for me to get care for a patient that I went to school for.
Well, what's interesting to me is they'll have a visit limit number a lot of times. And so they have these visits, but they have to get authorization to actually use the visits. But they have a number of visits already.
Yeah.
And so it's very interesting that we have to ask to use those visits. Personally, I think if a patient has visits, they should be able to use them. That's their benefit. And that's one thing that we can fight for. I know we're already fighting for it, here at Foundation, but we need our patients to fight for it too. Hey, those are my visits. I want to be able to use them when I need them.
Yeah, exactly. Keep going on the things that you suggest patient call on. Sometimes we have delays. Tell us about those delays.
Yeah, well, we can submit pre-authorization and then need to wait, weeks sometimes before we hear back. And that's a delay in that patient's care. They're going to be in pain waiting until we get those visits authorized. And so that's something that patients can call in about. Hey, I need those visits. I need that approved. What can we do to speed up that process? Because sometimes as, providers, we've done all we can do. We've done our part, but it would definitely help if our patients are going to advocate for themselves and call in, try and speed up that process.
Could you imagine, say you got a total knee replacement and you need to get that puppy moving really quick, right? Muscles atrophy. We did a bed rest study up at the University of Utah, and we found that we put college students in bed for 7 days, and we measured their intramuscular tissue, like how strong they were, how much fat was in their thighs and things like that. What was interesting is some of these college students lost up to 50% of their strength just in 7 days, right?
That's major.
And if there's pain inhibition and things hurt, they're not going to want to move even more, right? Our purpose in therapy is to get things moving pain-free, right? And teach people what they need to know. But if I have 2 weeks, imagine how much strength I'm losing. Imagine how much tightness I'm getting through that knee. People are lost. How much pain is going on in 2 weeks? They're stuck in bed or they can't get around their house.
That affects their life every single day, that they're in pain and they're not able to function where they should be.
Yeah. And I really think we can do better in insurance companies that we have to set an expectation of these authorizations. In my view, 24, 48 hours. I don't know how that's difficult, and maybe that's something that we need to work on with insurance companies as providers, is challenging that and setting a law that says you have to respond to us within 48 hours, and I don't know where that's going to go, but I really feel that we have to push on that. Who would you say has more an influence on insurance companies, providers or patients?
Oh, the patients, absolutely, because they work for you. We have to get authorization from them because you're using them for your benefits, but the patients are going to have a lot more sway than we do because, hey, they work for you. You're the ones that are employing them. Without your money, they don't have a job. So
I have a friend that she couldn't get her son in to a big hospital system here in Utah for some behavioral health issues, and they were very emergent. She went in the middle of the night and she was told, sorry, we don't accept your insurance at this major hospital system. But she went and just applied a ton of effort to this.
Good
And
for her.
she advocated for her son at such a high level. She ended up getting the VP of her insurance company to go to lunch with her.
Wow.
Like this
That's
literally, I was
wow.
just messaging her last night. And I'm like, that's what we need. We need people that are advocating at such a strong level for themselves, their family, that they're getting the attention of these CEOs, the VPs that are really making a lot of these changes. And she ended up getting some admission to another hospital. Like they just pulled
Wow.
some strings for her because she realized that she's paying these people and you need to get their attention.
And every
you know?
patient deserves that,
Yeah.
which is why we all need to fight for it and
Yeah.
all work together to fight for those changes.
And I think a lot of the times they don't happen because we're not fighting for them.
Absolutely.
And I don't even know if fighting is the word. Really true advocacy.
Yeah.
If I'm not getting a service, I went to dinner with a friend the other day, and he's hilarious. If he doesn't get the service that he deserves and he's paying for, he'll make it known.
Yeah.
Right? The server had forgot the bread appetizer he's going to bring out. They forgot one other thing with our drinks. And he was just straight up. The waiter came over and says, "How's your service?" He says, "It's terrible. Honestly, like I'd really appreciate it if you step it up." Right? And they stepped it up.
I was gonna say, and did they?
They brought bread, extra bread. They even gave us free dessert. And I think that's a lot of what the world should do, right? We're so
Right.
afraid to have these difficult conversations, but a lot of it is just setting an expectation and letting people know, like, hey, there's a gap between what I was promised and what I'm getting.
Absolutely. And
And if-
sometimes all you have to do is ask, right? Like in
Yeah.
that instance with your friend, as soon as he asked, they changed and they stepped it up, which is what
Yeah.
they should have been doing all along. But that's okay because he made that change happen.
Yeah, absolutely. And, I think just across the world in general, we could do a lot better job at that. Like, speak up.
Absolutely.
Rather than just kick it to the curb and write a bad review, give us that feedback so we can change it right now. And I truly believe insurance companies are wanting that feedback as well. Some of us think that they're just all a bunch of money hungry people, and some of that may be true, but I think a lot of it, they're good people in that, and they want to help people. They want to help our patients, and sometimes they just don't have that feedback to actually make a difference.
Absolutely.
Let's talk about different things that what do providers have to go through? What do you see?
One thing I see providers, and we have somebody at our clinic who is constantly doing what's called a peer-to-peer review. So if I submit an authorization and it comes back denied, but our patient still needs visits, then our providers have to do what's called a peer-to-peer review where they get on the phone with insurance. And these providers are doing them during their lunch breaks. They're doing them before work. They're taking time out of a visit with a patient so that they can get on the phone with insurance and advocate for another patient, which props to our providers. They go the extra mile for the patients, but they shouldn't have to do that. It's too bad that they have to take the time out of their day because insurance closes at the end of the day. So they need to take time out of their super busy schedule, take time away from writing notes to advocate at the fullest for our patients and make sure, hey, this patient's not better yet. They need more visits. Let's get those for them.
This is a huge issue. I mean, I think I was telling you this the other day. I was trying to get a MRI approved for a patient that was getting worse in therapy and had hard neurological findings. Pain was getting worse. He was very appropriate to get an MRI. This was, 5 visits in. And I submit for insurance to approve this, and they deny it. And if you want to rile me up, just deny a care to a patient, right?
Yep.
I mean, you know me. I get super riled up about patients getting denied care when I know that I've created an exceptional note painting the picture of what this patient needs.
Absolutely.
Sometimes I'll have these peer-to-peers where they're like, "Oh, I didn't read that," or "Oh, I didn't get that." I'm like, "Oh boy." I'm literally taking away time from another patient to jump on a call with you when we all know that this patient needs this care.
And
right?
it's not just your time, it's the insurance company's time too, right? It's everybody's time. It's the patient's time while they're
And I had
waiting, wanting to get better.
I had to escalate it to 4 people. The first provider told me, as a DPT, you can't order imaging in Utah. And I'm like,
What?
oh boy, have you checked my practice act, son? I was like, don't tell me I can't order imaging. That literally is my state practice act. It's been there for years. You should update your insurance company and let them know we are providers in the state of Utah, we can order imaging, and we have every right to.
Yeah.
We have the education to, and we're appropriate to be able to order that, right? And he said, well, we'll just have to escalate this. I'm like, please do.
Mm-hmm.
And escalate it very top, because I don't want to waste any more time. And I don't want to be rude. I really am just advocating for my patients.
It's all for the patient.
Yeah.
Yeah.
And then it ended up getting to the next call and the next call. And this is all while I'm treating patients. I'm like, I'm so sorry, I got to take this call, right? And then it just gets up to the fourth one. And the fourth one told me, I want to hear your story. And I told him the story. He says, as a DPT, you can't order imaging. I'm like, all right, done. I'm sending him to the emergency room. You can pay that bill. Mm-hmm. And guess what they said?
We'll order it for you.
Yes, that's exactly what happened. And, that's true advocacy, for our providers to, advocate at that high level, because when we know they need something, we will do everything in our power to get it.
I was going to say, do you know what I love about that story is that you didn't give up, because our patient is number one. Them getting better is our biggest priority. Mm-hmm. And so we're not going to take no for an answer. We're going to keep going until our patient gets what they need.
Absolutely. And that's a huge aspect of what I feel we need to do across all of healthcare. That is one thing I'll never do. I don't even care if I have to go knock down the doors, go downtown, wherever these people are. I'm going to knock on your door.
We're going to do it. Yeah.
I'm going to do it in a kind way too. Obviously I get very passionate about this, but I also want the best care for my patients. And I've studied very hard, exceptionally hard, to know what I know. And I know when it's appropriate to order an image, and I know when it's not either.
Absolutely.
But across healthcare, I really feel like that's what we need to do, is condense and decrease how difficult it is for people to navigate this system. Any other thoughts on just navigating the system and tips that you would give patients to be able to navigate this difficult system better?
Yeah, I think one thing that's so important for patients is to know their own benefits. Call your insurance. If you look at the back of your insurance card, there's a number. It'll say probably member services. You can call your insurance and speak to an agent that is there waiting and willing to explain it to you. Mm-hmm. I think if you know your insurance benefits, you're going to come in a lot more prepared, because you'll know what to expect. You're not going to end up with a big bill at the end. And not all medical companies are going to do a PFA like we do. So it's important for you to advocate for yourself and really understand your insurance benefits. Keep asking questions until you understand how your benefits work. That's the biggest tip that I would give.
I love that. If we all understand what is the expectation, right? What am I actually paying for? You would never go buy a handbag at the store and take it home and not know what you're paying for it, and then get a bill 3 months later. That's absolutely ridiculous, right?
No. Yeah.
And I believe, don't quote me on this, but I believe there's a law that states cost transparency in healthcare is required. Right? So if you don't feel that you're getting that cost transparency, you need to ask. And if you don't feel like you're getting that information, get to the right person. Right?
Yeah, don't give up. There's somebody out there who's going to be able to help you and answer your questions.
Yeah, I really feel that these will be super powerful for our patients. Thank you for joining us today, Victoria. We appreciate what you do for our community.
Thanks for having me.
And you have a great rest of your day.
You too.